Good afternoon again, and Happy New Year. Happy New Year to everyone here, and of course to all the residents of the city of New Orleans. We should feel blessed and definitely highly favored as we move through 2020 and into the year of 2021. Make no mistake about it, we bring the spirits of those that we lost in 2020 and their legacies right along with us as we're now moving into 2021. We have been through a lot together, and we're going to continue not only to go through it, but we're going to get through it better and even stronger than we were when we came on into this. So I'm here today to announce the first step on our cities. We're calling it our road to recovery, a path forward as it relates to where we are now and how we're going to move through the year of 2021 and continue to focus on the pandemic, the impacts that it's had on our city, on our residents, and how we're going to, again, move forward, making sure that our city is better than it was before in terms of pre-COVID. I am joined, of course, by my CAO, Gilbert Montano, also CFO, Norman White. I'm here with our public safety chiefs, whether that's Chief Ferguson of New Orleans Police Department, Chief Nelson, New Orleans Fire, Dr. Emily Nichols with EMS, and our Chief Samaron, who's with us as well. Dr. Jennifer Vegno, who is a Director of the Health Department, joins us as well. Thank you all so much just for your diligence, your leadership throughout not just this past year, but really just throughout our term. We have come through this together and facing all of our challenges in order to fix them and for our city to be better and her people. In the weeks ahead, we will come before you with specifics as it relates to emergency response, business response, our community response, and organizational changes as it relates to the city of New Orleans. This is the first step in that, where we're shaping this around public safety and public health this afternoon. We are in no means out of the woods with this pandemic. You should know that better than me, but it is worth repeating. We are not out of the woods at all. We must remain flexible as we move through. So in terms of our economic impact, again, not out of the woods. We're still hurting, and the hurt is significant, and it is real. In terms of the ongoing, again, public health threats regarding the pandemic, again, not out of the woods. It's worth repeating. We still need you to wear those masks, keep your distance, wash your hands, and just follow the guidelines of the city of New Orleans and that of the state of Louisiana. The first step in our road to recovery is really ensuring that we not only maintain, but that we also enhance our capacity relative to public safety and public health. So I'm glad really to announce today, I'm excited, really, a lot of hard work that continues to go on with my team regarding the impacts that we have. But I'm glad to announce that effectively, actually on yesterday, but I'm saying effectively immediately, we are lifting the furlough requirements from our public safety and public health first responders at the New Orleans Police Department, New Orleans Fire Department, New Orleans EMS, and the New Orleans Health Department. Additionally, I am removing furlough requirements from the staff at the Juvenile Justice Intervention Center, JJIC, for several reasons. One, due to their acute staffing needs and constraints that we have been seeing over the course of the year. Very important and critical that we keep them staffed up, and we're focusing on that. Also, as it relates to the state level guidelines that we're faced with in terms of JJIC and maintaining and staying above so that we are not dinged in terms of our juvenile detention center. Also, as it relates to our consent decree that we are continuing to be in, and we're moving, making very good progress, but it's critical that we're able to be fully staffed, fully functional at JJIC, again, to be aligned with the consent decree requirements. We are making this move as a part of a much broader effort to restructure how we use our public servants, public employees in the city of New Orleans. You've heard me talk previously just about, making sure that it's not just a pandemic, but any crisis that comes our way, we're able to manage through it in a much comprehensive and a holistic manner that utilizes our public servants, public employees, as effective as possible. Because we've realized during this pandemic, everyone matters and everyone needs to have that shared sacrifice and do what it takes to move this city forward. As the demands of this pandemic continue to change and evolve, and it will continue to change and evolve, we are remaining flexible again in our response to meet those challenges. And as we continue to look at the landscape ahead of us, we feel more comfortable about the options available to us, in addition to just more concrete information about the challenges that we're in, that we face, and how we're planning to move through them. So that includes our vaccine response, needing to get all of our people vaccinated, and of course the vaccine, the availability of the vaccine and how it will be distributed. And just the bottom line, the realities that are on the ground. And you'll hear more from Dr. Vegno as it relates, and also our chiefs that will give you a little bit more meat. But as I stand here, stand up with my public safety officials, and also as we look towards city services and all of our city workers in the new ways in terms of how we have to respond collectively to the needs of our people. Again, going back to the vaccine rollout and its distribution, we have to be creative and we have to stay agile. So all options must remain on the table. And what I mean by that, it includes the COI, the loan that we got ahead of time, right at March and April. Again, thinking forward, one of the first cities in the United States to implement that because, again, thinking forward. You don't wait until you run out of gas before you figure out how you're going to get more. So this includes our loans, layoffs, as well as our stimulus funds. So we're having to, again, remain very flexible and agile. Everything we do is geared towards meeting the current needs related to COVID-19, but also ensuring that the city of New Orleans continues to make progress in spite of the challenges that we face. So we're wanting to maintain as well as enhance our capacity, again, to respond to the needs of our city. And today, we're highlighting this very closely to public safety and public health. So without further ado, I'm going to ask my CAO, Gilbert Montano, to come forward and we'll give you more information. We'll move through this press conference where you'll hear from our department, our chiefs and department heads, and then we'll go to Q&A. So thank you again, and Gilbert.
Thank you, Mayor. Thank you, Public Safety Chiefs. I'll be very brief. One of the things that we've always tried to highlight as an organization, especially when managing a city through a pandemic, is to remain agile and making sure that you are able to adjust accordingly. As the Mayor announced, it's important for the administration to relieve public safety frontline employees from furloughs. Now, in no situation did we get any kind of influx of cash or do we have any new revenue enhancements relative to that. But as the Mayor alluded, what we are hopeful for is the future horizon of the stimulus funding and the projections that the vaccines can provide and alternatives to some of the decisions people are making as it relates to sales tax spending and the like. So what we'll do essentially through the beginning part of the year is utilize and draw down on the COI, as the Mayor said, to be able to relieve these employees from that furlough period. It's going to be an important cash management process that we have. This will affect about approximately 2,243 employees, and the cost will be approximately about $16 million. Just to reframe those numbers relative to what we passed in the most recent budget, $607 million budget. Of that, we cut about $100 million. So the bottom number was 607. We cut $100 million. The overall furlough cost was approximately $28.6 million. So we're going to utilize about half of those employees relative to the public safety employees. It's an important measure for the benefit of the public as it relates to the public safety enhancement, as the mayor said. And each one of the chiefs will give a little bit more details for that. Once again, I want to re-articulate, New Orleans was significantly affected. We do not have a very diversified economy. So when you have a large portion of your revenue tied up with tourism dollars, our city will be hit more than any other city in a lot of the country, other tourist related. Our goal through our recovery plan is to better diversify that economy so that we could have a more stable government operations and not have such an influx of ups and downs relative to our financial picture. So once again, we are not out of the woods. We have a positive horizon with a vaccine and a future stimulus opportunity. We are going to leverage and draw down portions of our COI to be able to pay for this, and then we'll be able to reevaluate toward the middle part of the year or before to see where we're at financially and organizationally. That essentially, Mayor, is the piece that I was going to cover, and I will pass it back to you.
Okay, thank you so much, Gilbert. And we're going to hear from Dr. Jennifer Begno, who will give you, come on, Doc. Thank you so much. This is our public health aspect of this press conference.
Thank you, Madam Mayor and team. Thanks for allowing me to give a little bit of update today, focusing on vaccines. It really can't be overstated that vaccines are our way out. They're our way back to overall health. They're our way back to normal functioning. They're our way back to fiscal health as well. So the fact that we are up and running, and to date 4 million people and counting across the country have received their first dose of vaccine is something to be excited about. So far in Louisiana, as of Thursday, over 45,000 folks had received their vaccine, and we expect that number to be much greater. Several of us are receiving our second dose this week. I'm getting mine tomorrow. I will tell you exactly how I feel for the next couple of days if you are interested. Just an overview of where we are. The state, as you know, put out its next tiers and priority groups for vaccine distribution over the holidays. We are still in phase 1A, which is, again, our healthcare workers and our long-term care facilities. Those are proceeding. That is ongoing. Rather than wait until the end of phase 1A to go into the next priority group, the state has done, which I think is a very smart move, is trying to leverage the doses that they are getting and the doses that they have to expand. And where they've chosen to expand are our elders. And the reason they have is because it is very clear that this pandemic has hit them disproportionately in terms of hospitalizations and deaths. So it is a very clear mission of preventing suffering and death. As you all have seen today, they announced partnerships with 100 pharmacies to begin vaccinating ages 70 plus. Right now, they have 10,000 doses of vaccine to begin. That is not nearly enough for every elder that wants to receive a vaccine in the state of Louisiana. And again, that's where we really have to manage expectations. As much as we would all like to have 4.6 million doses, or in New Orleans, 400,000 doses of vaccine available immediately to vaccinate everyone, that is not a possibility. The state is reliant on the federal pipeline, and they do not know more than a few days in advance how many doses they will be getting for the next week. So it's a lot of planning and trying to be conservative to make sure we do not waste a single dose. So while it's encouraging that pharmacies are starting, we know this is the tip of the iceberg in terms of our seniors. You've also heard that some of the healthcare facilities who've been administering to their staff are also opening very, very, very limited appointments for their senior patients. Again, they are trying to be excellent stewards of the doses they've been given. Nothing is going to waste. Everything is focused on utilizing the vaccine as quickly as possible, but there are really some significant logistical hurdles that are beyond a lot of our control. The next group is a fairly wide group. The tier, phase 1B, tier 2, is a wide group of individuals who all have direct higher risk because of their exposure, the job that they do, or other circumstances. The state made this decision based on the CDC recommendations, and they're very solid. We know that that doesn't cover everyone that we would like to cover. We also, there's a lot we don't know about when the vaccine will be available to that group. And again, that's because of the some of the challenges. We are already starting to plan, right? No one at the state or city level is waiting until the day before it's time to do this plan. We are working very, very closely and have been for months with our state partners, with our healthcare provider partners, with community groups around the city to support the efforts at the state. This is going to be a huge team effort, and it is going to involve lots of folks from around the city as we work together, as we make sure that everyone has access when it's their time and we can get it to them. So we really, really appreciate the vote of confidence, Gilbert and Mayor, to help us do this, to help us have everybody who can work available to work every single day, nights, weekends, so we can get this out. There's a lot more details, obviously, and so, we can get into those in Q&A if people have other thoughts. But I will echo what the mayor said. We are nowhere near out of the woods. In fact, we are probably at a worse place than we have been since April in terms of statewide and also locally. We have grave concerns about what's happened over the holidays. We cannot see vaccines as our way out and abandon all the things that have kept us so safe for the last 9 to 10 months. So nothing is changing. We all must, as the mayor said, wear our mask, avoid gatherings, and socially distance. Then, when it comes time for the vaccine for everyone, it's going to be a much quicker, faster uptake, and we will get back to normal more quickly. Thank you.
Thank you so much. Dr. Avegno, thank you so much. And I'm going to turn it over to Superintendent Sean Ferguson, New Orleans Police Department. Thank you, Chief.
Thank you, Mayor. Good afternoon, everyone. Happy New Year to you. No doubt this last year has been a very challenging year for us all, but this is a new year, a new time. So today is a new day. Very great day for our department, very great day for our city, as we all try to maintain and enhance our services for our great city. Let me start first and foremost by thanking you, Mayor, for your commitment in fighting to protect our community by always prioritizing public safety. 2020 put us through a lot. Every month there's a different challenge. First and foremost, COVID-19, which does not respect the date and the change in a year. It remains a challenge as we move into 2021. The surge in violent crime, not only in New Orleans, but across the country. Our hurricane season, which lived up to the predictions of being exceptionally active. We witnessed marches, demonstrations calling for police reforms in the wake of killings of unarmed African Americans at the hands of police in various cities across the country. However, I am very proud to say your New Orleans Police Department adopted these reforms many years ago, and we continue to be that leading agency in reform for constitutional policing. With that being said, New Orleans Police Department remains engaged and prepared to meet the continuing and new challenges of 2021. I'm grateful to hear that the New Orleans Police Department has been removed or is no longer subject to furlough days at this time. But despite losing a day of wages per pay period, the men and women of the New Orleans Police Department remained engaged. We never wavered in their duties or their professionalism. Through strategic and intentional scheduling, the furlough days had minimal impact on the New Orleans Police Department's crime-fighting ability. However, eliminating the furlough days will be a boost of morale to our department. As we move forward into this new year, I will continue my assessment and evaluation of our department's efficiency. Processes and policies will be examined to determine if best practices are being used. I will continue to make changes when necessary to bring about the most efficient service to our community. Improvement is one of the cornerstones to success. We must change and mature with the times to better serve our community, but we cannot succeed in a vacuum. New Orleans Police Department looks forward to forging a more robust alliance with our partners in our criminal justice system. In coming weeks, my team and I, will meet with our various partners, including the Chief Criminal Court Judge, the Chief Juvenile Court Judge, the DA-elect, and other components or other representatives of our criminal justice system. We need to formulate a better strategy to hold the entire Orleans Parish criminal justice system accountable for taking violent offenders off the streets and keeping them off the streets. If 2020 has shown us anything, it's that no matter how separated we are a solid and strong community, vigilant and determined to meet and beat any challenges that confront us together. So again, thank you, Mayor, thank you, CAO, and thank you, CFO, for allowing us to move forward in enhancing and maintaining the security of our city. Thank you, Mayor.
Chief. Thank you, Chief, and we respect and appreciate all the members of the New Orleans Police Department. I'm going to ask now that Chief Nelson come forward with the New Orleans Fire Department.
Thank you, Mayor. Happy New Year to everyone. I just want to start off, Mayor, by thanking you and the team for this. This is a big thing that will go a long way to helping with public safety in this city. It's going to be good for everyone, not just for the firefighters, but it's going to be good for the public. Our firefighters out there every day on the front lines dealing with COVID response, not just on the medical calls that they make in partnership with EMS, but also on the public assistance calls and various calls they make where they have to be in close contact to the public. So we've been seeing the spikes and surges in the levels of firefighters out every day with COVID, just like the public has. So this is going to be a great thing to help us to get all hands on deck, keep all hands on deck, and just maintaining and enhancing, as the mayor said, the levels of service that the fire department is providing to the public every day. One good thing on the horizon, we've talked about this before, but the fire department has a grant that will allow us to hire new firefighters in 2021. So while most hiring for the city is on hold, we will be hiring new firefighters. We're working on getting in class right now, and we'll also be working with civil service to open a new testing process back up because we're going to need to hire new firefighters during 2021. So that is a bright thing on the horizon that will help us with the staff and to better serve the community. Thank you.
Thank you so much, Chief, and thank you for mentioning that grant we all worked so hard to secure for the city of New Orleans, and in spite of a pandemic. So thank you so much, and of course to the men and women of the fire department. So at this time, I'm going to ask Dr. Nichols with New Orleans EMS.
Good afternoon. So Mayor, Mr. Montano, Mr. White, I would just like to say that I'm so grateful for your commitment to making public health and public safety a priority for our city. In 2020, New Orleans EMS, we responded to almost 60,000 calls for service. This number is actually a little bit less than it has been in recent years, but we responded in the midst of COVID exposures and staff shortages that continue until this day. As of last week, 63% of our staff have been out ill with COVID symptoms since March. We have employees that continue to have long-term symptoms many months after they were infected. They are our COVID long haulers. We now approach every patient believing that they may have COVID, and we keep going in and providing the care that they need. One of the core metrics that we track is how often we're actually getting to our sickest patients in a timely manner. And I'm proud to report that in 2020, we hit that marker 72% of the time. That is up from 66% that I reported this time last year. We've grown stronger, and we've worked harder through sickness and through furlough, and we still have more work to do. Having the support for our first responders is a silver lining through this ongoing difficult time. Our EMTs and paramedics are much more than ambulance drivers. They are a fundamental part of medicine within our community. We've spent many hours over the last several years teaching CPR training, teaching lay people how to stop the bleed, how to control hemorrhage if they suffer any sort of significant injury. We're continuing to enhance that in 2021 because we recognize that empowering our people with knowledge and education about health makes them stronger. Prevention and early intervention is the key to lives saved. We know that cardiac arrests, strokes, heart attacks are all significant causes of death within our city, and we want to be a part of decreasing that, making our place a healthier space. The medical community truly appreciates that Dr. Avegno and the mayor have made decisions about COVID-19 based on science. We know we're not out of the woods. We know that this winter could be very difficult and that more lives could be lost from this disease. If you know of or love a police officer, a firefighter, a medic, EMT, a nurse, a doctor, a lab technician, an office manager, a grandparent, a parent, please continue to wear your mask. Stay at home. There's no reason to go out if it's going to kill somebody. Maintain your 6 feet and ask us about the vaccine. I'm more than happy to tell why I took it and why I approached head-on the fears and concerns of mistrust that we know that exist, and why I still felt that it was best. We have to all do this together to fight through this disease. Thank you.
Thank you so much, Dr. Nichols. Thank you so much, and that concludes really our message for today. And Ms. LaToya, I'll just turn it to you.
Thank you, Madam Mayor. WDSU? If you could just explain a little more about how the vaccines, and I believe you said the stimulus money will impact, I thought I heard you say sales tax enough to make it to where we won't have to go back to furloughing city workers. If you could just kind of talk about.
Well, it's a couple, I get where you're coming from, but it's kind of muffled. In terms of the stimulus, we will continue to advocate, lobby at the highest level, which is at that federal level, to make sure, as we've been pushing for the city and local governments, not just for New Orleans, but yeah, we care about New Orleans, getting our fair share relative to an additional stimulus package to assist the city with the revenue losses that we continue to experience. So we have not gotten additional just yet, but we'll continue to work towards that. Not knowing, right, means timing. So we're confident at some point the local government, the city would get resources, but we don't know the timing of it. And not knowing the timing of it puts us in a very peculiar situation as it relates to cash flow and monitoring the spend and also the dollars that come in. And then you mentioned something about the vaccination. I forgot, I've lost that, I don't remember.
It's what I thought that I heard Mr. Montano say, just as far as the vaccinations and then also the stimulus money, how that works too.
Okay, so one of the things when we talk about and we tie vaccinations into even how we manage or be able to maintain and operate the city is that getting the vaccinations out, it's going to take public servants, employees of the city, to be more creative and innovative in our approach to disseminate and distribute that vaccination. So in thinking about that, particularly public safety and public health, that's why we moved as fast as we could to ensure that we removed this particular team off of the furlough list. And we'll continue, again, to have everything on the table. But again, it goes back to the timing of when resources additional will come our way. Right now, that is not the case, but we'll continue to push and advocate for those dollars that we know we deserve. Revenue loss is real, and as we move into, we're in 2021, and the first quarter of the year is still when you're expecting property taxes, right, to be submitted to the city. So it's a very fragile situation, and we have to remain fluid as we move through this, and the implications, financial implications, are real. Now, I'll ask Gilbert, and I'll also ask Norman if there are any other points that they would like to share with you at this time that may give you a greater understanding. Gilbert?
Thank you, Mayor, and I'll be very brief. Just to go back a little, remember, budgets are developed on projections. So we projected each quarter, each month, each year, how much revenue we think we will attain for 2021. With the vaccination deployment and some positive movement that we feel confident in at the stimulus level, we are able to accommodate the approximately $16 million out of the overall budget cuts, which was approximately $100 million, to be able to relieve our first-line employees from furlough days. Now, that's something also that may not come to fruition, so we are not banking on everything that we said. We saw another stimulus fund in the most recent year get depleted significantly from what we needed for it. So we do have precautions and measures in place should we not receive a stimulus funding, and the ideas and plans moving forward from there. So once again, it's scenario-based, it's projection-based, but we feel as a team confident that this is the right move, and this is a positive movement for the City of New Orleans.
Anything to add, Norm?
I think you covered it.
Okay, thank you.
With the positive cases and the hospitalization rate so high, what do the numbers look like as far as hospital capacity? And with the high numbers, does it look like we may have to activate the convention center?
Well, I'll have Dr. Avegno give you more information on that, and you should expect also us coming back to you on Wednesday after we get our latest counts, from the state level, that would determine if there will be further restrictions or not. But Dr. Avegno?
Yeah, I'll be blunt, as I usually am. We are approaching the highest level of hospitalizations that we've seen statewide. I just looked at the numbers that I received today. I think we're within 20 COVID hospitalizations of where we were in the peak in March and April. And anybody who was near a hospital in March and April knows how scary that was. We have, we know a lot more than we did in March and April. And our colleagues on the front lines in hospitals continue to do phenomenal work in keeping people healthy and alive who happen to be hospitalized. However, what we don't have, that we did have when the state had a summer surge and then earlier, we don't have extra staffing capacity. We don't have any nurses, respiratory therapists, ancillary staff coming from anywhere else. So we are in a really rough spot. I have not heard anything, that doesn't mean it hasn't been discussed, about reactivating the convention center. I know the state is actively working with hospitals to try and preserve capacity and make sure we can care for everyone who needs to. But again, we are in a really dangerous spot. And if we don't all absolutely double down on the preventive measures that keep people out of hospitals, we might be in a different place in a matter of weeks.
One more question for you, Dr. Vegno. You mentioned how pharmacies are receiving vaccines now. Do you know where we stand as far as them getting shipments in for the second round when it comes time for that?
So generally, when like I said, it was 100 pharmacies. The list of the ones in Orleans Parish are on our website, and I know that several of the news agencies have put it out sort of in the greater New Orleans area. When the state plans, they don't just plan for the first dose, right? They have a plan for, in this case, I believe it's all the Moderna vaccine. So whatever the 10,000 that are going out today, they have that allocated 28 days from now, another 10,000 will be able to go so people get their second doses.
Chief Ferguson, we were hoping to see if you had any information or wanted to make a comment regarding the woman shot overnight in the IHOP parking lot.
IHOP parking lot. Are you talking about the homicide, or I'm not familiar with the, okay, so right now there's an active investigation. We do have some possible leads. I'm confident that my team will be briefing me with some great news by the end of this week, but there's nothing more that I can really say right now besides the fact that it's an ongoing investigation and a very, very tragic incident that occurred in which we lost another one of our citizens to senseless violence. So again, very ongoing, very beginning stages of this investigation, and I will give you more as I get it, but right now I'm just not in a position to give you any more information on that.
Yeah, you mentioned
Norm, you want to speak to that? Sure. Yeah, just speak. That's fine. Multiple things.
Yes.
Yeah.
Yes, the plan that we put together to kind of make the city financially secure is to deal with the flexibility. We started off with basically cutting the budget $100 million, like Gilbert spoke to earlier. Now, as revenue projections were built on conservatism, the key would be is if things go accordingly, the numbers may come back in better if we behave and take the preventative measures that were outlined earlier, and the vaccine and all those things take place accordingly. We may be in a better position. We just don't know that. In the event they don't, we are using the cash flow program we projected earlier through the COI, which was around $50 million. Now, that will float us through the year. As you know, our revenue comes in pretty much at the beginning of the year, so we should be okay then. When we get towards the middle of the year, when we start really receiving some problems if we don't get stimulus money, the cash flow from the CIO will help us get through that. Hopefully, revenue increases. That will help us deal with it even further. And on the backdrop of that, if there's some federal support through stimulus mechanism, that will help us in additional. So we have three different pieces. And in add, I want to say, if those things don't occur, then we'll have to move to layoff to make sure that we remain whole.
So if those don't come through, is there a plan in place for layoffs already, or?
We will be, right now, we're required to put in place by a number of days before those layoffs will be enacted. Those numbers and positions will be submitted through civil service at that point, once we recognize those items, whether it's the stimulus or the revenues don't increase, then we'll employ those individual layoffs at that particular time.
Is there a drop dead, is there a specific time period for that, or is that a rolling?
Well, we're going to assess this every month, right? So as we go into February, go into March, we'll begin to look at the situation, where we look at the revenues, what the stimulus conversation is. When we get into July, we'll be able to make those decisions. But as the mayor spoke to earlier, we just don't know. We're just trying to remain flexible to the point that we react accordingly when we know different situations. So there's no drop date. We'll remain flexible. But we'll let you know once things occur or don't occur.
Thank you, Norm.
Sure.
All right, thank you so much. Thank you so much. All right, thank you all.